Hello, I'm Greg Nichols, the Science and Technology Advisor for the Homeland Defense and Security Information Analysis Center. Today we're going to talk about new techniques in diagnosing traumatic brain injury. Traumatic brain injury, or TBI, is one of the hallmark injuries that we've seen in recent conflicts in Iraq and Afghanistan. TBI is a type of injury that occurs in the brain, typically from some sort of force, either a head-on collision or a blast trauma, that actually causes structures in the brain to shear apart. The type of traumatic brain injury that is commonly seen in soldiers is a mild traumatic brain injury or a concussion. The typical way that concussions are diagnosed is a rather nebulous process in which MRIs or CAT scans are taken. Physicians have to look at the scans, make some other determinations as to whether or not further tests are needed. Then they make a decision based on their clinical practice. What happens though is that oftentimes this isn't the most accurate way to diagnose concussion, and sometimes these things can go undiagnosed for a period of time, in which case the soldier is actually experiencing increased symptoms, and the TBI itself was never accurately diagnosed. So some of the new procedures that have been developed are a whole panel of what we call biomarkers. Biomarkers are different levels of proteins in the blood that can be measured, and they typically increase and rise after an injury. One of the most common ones now that we're looking at is called tau protein. Tau protein is often elevated in other sorts of neurological conditions, and we have seen this a lot in specifically athletes who also experience concussion. A new type of EEG, which is a way to measure brain activity called a quantitative EEG, is being developed. It's basically a typical EEG, except instead of having a provider look at the graph that's produced, we have a series of algorithms that is more accurate, that can go through and look at different associations and pick out abnormalities and the actual electrical activity that's produced. And finally, there's been new technologies, specifically with sensors that can now be embedded into soldiers' protective gear, into their helmets and into their vest. And if there is an actual blast that occurs, these sensors can measure the force, and it often helps physicians diagnose a little bit more of the impact that the blast may actually have on a traumatic brain injury developing. And so it gives them a better picture of how much force actually occurred and whether or not it was sufficient to actually cause a TBI. So if you want to learn more about new diagnostic tools and traumatic brain injury, you can go to our website to find out more, hddiag.org, and don't forget to follow us on Twitter.